got some housekeeping, some things to go over before we start the official presentation anyway, so we'll go ahead and get started with that. We are recording this presentation, so we'll be, if anybody misses it, we'll be getting it out, and that way you don't have to memorize everything I'm saying either. You'll be able to go back and look at it again and go through it. So welcome. My name's Dr. Matthew Zademan. I already see some familiar names in the group here, so that's good to see. We're going to be talking about COVID-19. I don't think I need to really tell anybody about what that's about. I think everybody, even though we have been living under rocks, basically, kind of have some understanding of what's going on here. It is a pandemic right now. We don't have any real treatments, or it's a new virus. That's always the case because we haven't had time to do really in-depth research. But there are, we have seen similar viruses. So coronaviruses are not necessarily new. We've had several different strains of coronaviruses, and we do have a good amount of research of what has worked on them in the past. So we're going to be talking about some immune optimization strategies today, and give you guys some solutions to help protect your immune system. Because outside of not getting this, that's the big thing. I mean, obviously, if we can prevent from actually coming in contact with the virus, that would be the best thing. And that's the whole point of social distancing and that type of thing. But when it comes down to it, if we do get exposed to it, we need our immune system to work as well as we possibly can. All right, and just for if anyone else has popped into the chat here, if you have questions, please just put it in the chat feature here. I'm going to answer questions at the end. But if you think of some as you go, feel free to go ahead and put them in there, and we'll go from there. Okay, so a quick disclaimer. We try all the time here to give you the most updated information as possible. But please know that none of this has been evaluated nor approved by the FDA or its affiliates. There are no approved or specific recommendations for COVID-19. These recommendations are theoretical applications based off research on similar viruses. Recommended dosage we'll talk about are for adults. Any treatment should be monitored by a licensed physician. I do not encourage any person to lessen or discontinue any prescription medication, nor use prescribed nutrition without consulting with a prescribing doctor first. Again, this is supposed to be educational. This is not intended as medical advice. Real quick acknowledgement. I want to give special thanks to my colleague out in Colorado, Dr. Brett. He's got his website here and Facebook. He is responsible for a good chunk of the content here. He did a lot of the research to come up with some dosages and different antiviral strategies. So I definitely wanted to give him a good shout out here for that. If you have family and friends out in Colorado, definitely would recommend him. And then if anybody should follow his Facebook. They do a real good job of pumping out really good content. My background, I'm Dr. Matthew Zademan. I know some of you know me already. I'm a doctor of chiropractic medicine. I'm also a certified functional medicine provider from the Functional Medicine University, which was about 300 hours of postgraduate work. I am the owner and medical director of North Florida Spine and Wellness, and I also have a certification in childhood neurodevelopmental disorders. Okay, well, let's start talking about the topic here. So what we're talking about is COVID-19. The official name for this virus is SARS-CoV-2. It's a respiratory virus from the coronaviride family, and so that just means it's a coronavirus. So coronaviruses are commonly known as the common cold. That's a lot of our common cold viruses. And then we've seen more severe forms of this virus like we're seeing now, and then also SARS and MERS and things like that. So it's an envelope virus, and that's a really important point. I want you guys to really kind of put that in the back of your head now, because that's going to be really important as far as how we talk about how we go after this virus and how we attack it. This virus, we think, originated from animals. Supposedly someone in China ate a bat that had the virus and he got infected, and then it was able to make the jump and start spreading from person to person. It spreads from person to person via respiratory droplets. So when someone sneezes or coughs, basically if those particles, if you get those particles on your face or mouth, or even rub your eyes, anything like that, that virus can get in and then start infecting you, and increasing its viral load. So that's why people are telling you to wash your hands. That's why people are telling you to keep your hands away from your face and mouth. It can also be transmitted, of course, through hard surfaces. So we don't quite know how long it lives in some surfaces than others. Some say, 3 hours, some say 3 days. It kind of depends on what type of surface that we're talking about, to be honest. There's even a report that they found virus particles on a cruise ship after like 12 or 14 days. But again, we don't know if that was like enough viral particles to actually infect the person. In general, these viruses really can't live outside of a host for very long. It's really dependent on host cells to replicate itself and survive. These are some of the stats for COVID-19. Now, about an hour before I did this, I looked at the Florida Department of Health dashboard, and of course they've increased since this. I probably shouldn't even done this slide because every time you refresh, it's changed. But this is the cases we're looking at worldwide. United States, about I know it's over 90,000 now. I know we're running around 2,700 cases here in Florida, something of that nature. When I looked at the last update. Our mortality rates running about 1.2, 1.5%. Florida a little bit lower right now. One thing you have to realize is that these are based off confirmed cases. So there's actually, we're going to find that as we test more, there's going to be a lot more cases. So we should expect this mortality rate to go down, which is a good thing. But it also means there's a whole lot of people walking around with this infected, but they may not have symptoms or may not think they're really sick. So that's kind of a double-edged sword here. There's an interesting study that was done on the infections we saw in China, and basically it came down to where they estimated 86% of all the infections were undocumented. So that means they weren't part of the confirmed cases. So the way you can look at that is the 80,000 plus cases they're reporting right now is probably only like 10 or 15%. So there was a whole lot more people that are infected. But like I said, the good news is that drops down that mortality rate quite a bit. So while that's still probably significantly higher than your seasonal flu virus, it's still probably much lower than what we're actually seeing. And this isn't I'm not going to get into the policy matters of isolation and what we're doing. I don't think that's really relevant to what we're talking about right now. But I think the take-home message here is that their mortality rate is going to come out a lot less, most likely. Okay, real quick, we're going to do some basic virology. So we're going to talk about basically how this virus operates as far as its structure. I'm not going to go into too much detail. I don't want to give you a headache here. But basically, we have envelope viruses, we have non-envelope viruses. That's a little bit of a simplification, but you can see on an envelope virus, we have this lipid envelope membrane. And what it does is it allows the virus to attach to a host cell and also helps the virus enter this deep into the cell and then take over our cell's machinery to replicate itself. So that's its primary function. It's also going to be a major target of what we're trying to destroy on the virus to fight against it. Okay. The next thing we're going to be talking about here is angiotensin converting enzyme 2, or ACE2. This is a receptor that there's a lot of these receptors in our lung cells. And what it does is it actually helps regulate blood pressure primarily. SARS, COVID-19, we know that it likes to dock to these cell receptors. So essentially, this is basically the gate or the channel that the virus uses to enter our cells, okay? It's not like this virus just floats around and just jumps into the cell. It's not how it works. It's got to go through a channel or gate, and it has a protein in that membrane that attaches to that receptor, and then it is able to then get into the cell. And again, the reason I'm telling you this is because this is going to be another target of where we're going to try to inhibit this virus. So one is just frankly, trying to destroy the membrane so we can keep it from its ability to attach, but we're also going to work on the receptor sites itself. Okay, so this is kind of a nice little, really complex looking illustration of how the coronavirus works. So again, you have the virus, you have this envelope lipid membrane, you've got this little spike protein here, and basically what it does, it attaches to these ACE2 receptors. That brings it into the cell. The envelope membrane uncoats, it then attaches to the machinery of the cell, and then it starts the process of replicating itself and creating new viruses. So that's how all of that works. When we talk about antiviral strategies, and this is going to be true whether we're talking about a natural product or even a pharmaceutical product, those generally are looking at attacking the binding or docking part of this, the uncoating part of this, or the actual replication process. Honestly, it makes sense to kind of go after all three of those stages, if you ask me, and that's what we're going to be talking about doing. Okay, so some common sense strategies. So when I started doing this presentation, I kind of broke down what we can do into three different categories. And the first one is kind of what most people have been telling you right now, and that's the common sense stuff. Social distancing, trying to stay away from exposure, not congregating in large groups, washing your hands. Do this for at least 20 seconds. You know, up here in Tallahassee, I tend to recommend, you know, singing the FSU fight song while you're doing this. You know, if you're more of a Gator fan, I apologize for that, but not really. Avoid touching your face as much as you can, obviously, and then disinfect surfaces. The good news on this is pretty much all common disinfectants work on destroying this virus. Even good old, when you're washing your hands, good old bar soap works really, really well. So all of those would be appropriate in this case. Okay. All right. Next category is going to be healthy lifestyle. So I think sometimes, let me go back. Went too quick there. I think that is a underrated thing that people don't think about, and it gets a little more difficult. You know, our lives are turned upside down. People's work have been disrupted. We're doing a lot of different things, so our routine is totally a mess right now. I totally understand that, but that's why I'm putting this in here. It's a good reminder that, you know, regular exercise, stress management, good sleep and nutrition, these are all things that are really, really important of keeping a healthy, efficient working immune system. Stress in particular, it raises cortisol. Cortisol will end up inhibiting our immune system. So these are going to be all really important things that we have to go after. Of course, stopping smoking, avoiding alcohol. These are all things that are going to be helpful. All right, so the third category is called, of course, supplementation. I'm sure that's what most of you were kind of most interested as we were looking at doing this presentation. What can you take? What can you do on a supplementation perspective that can, you know, give you the best chance of not only not getting this or fighting it if you do get exposed to it? So number one is going to be basic immune support. So we're going to start there, and then we'll go into more targeted antivirals. So the basics, vitamin A. Vitamin A is a very common fat-soluble vitamin. Under 10,000 international units is what I recommend as far as, you know, if you're just taking this daily, trying to keep this in your body. Over 10,000 IUs is where we can start to see symptoms of vitamin A toxicity. So especially if you don't have somebody really closely following you, if you're doing something like this, which I, of course, do recommend, then I would stay under 10,000 IUs. If we actually do have symptoms or we are infected with a virus, we can actually do vitamin A burst therapy, which gets into much higher doses, but that really does require the coverage of a medical doctor. So the most common symptoms you're going to see from, you know, the beginning of vitamin A toxicity, if you are taking vitamin A, even if you're doing lower doses, you're going to see dry skin and lips, headaches. It kind of feels like it's coming from the, you know, the back of your eyes, like your eyes are bulging out. That kind of headache is what you'll typically see. The good news is if you start have these symptoms, it's just as simple as you know, just stopping the supplementation and reducing the dose, and within 24, 48 hours, typically patients are starting to feel better. So like I said, even if you do go a little toxic, it's not a hard thing to subside off. But it's something we definitely want to be careful about. Okay, the next one is vitamin C. I'm sure we've all heard of vitamin C to one degree or the other. It has a long history, a lot of evidence of immune system benefit. We actually are seeing clinical trials ongoing with using vitamin C for COVID-19. I believe we shared an article on our Facebook page recently that was talking about vitamin C being used in hospitals in New York actually right now for treatment. Now, in the hospital, they're most likely going to go with IV vitamin C. Obviously, you can't really do that at home. Maybe some of you can, but I'm assuming the average person is not going to be able to do that. So, you know, and again, a lot of these nutrients, they're actually kind of hard to get. So, you know, liposomal, that's what I would recommend getting if you can, liposomal vitamin C. But if you can't get that, any kind of vitamin C in the correct dosage would be okay. At least 1,000 milligrams a day is what I would recommend. If you can tolerate it, going up to 3,000 and 4,000 milligrams would be a little bit better. But again, once you start getting those higher doses of vitamin C, you can have side effects of GI distress, so cramping, diarrhea. And just like the vitamin A, it's not so dangerous. You know, once you back off it, those symptoms should subside. Yep. Vitamin D, this is another one, you know, outside of vitamin C, probably another nutrient that we're all very familiar with. It's highly recognized as a good immune stabilization compound. You know, there's been meta-analysis done of 25 randomized clinical trials that basically have showed vitamin D reduce the risk of acute respiratory infection. And that seems fairly significant when we're talking about a respiratory infection. So again, that's not specifically for this particular virus, but it is something that would make sense in this type of situation. Vitamin D is also a big part of lymphocyte maturity and effective immune response. So when your body is making the white blood cells that actually help fight viruses, the vitamin D is involved in that process of actually making healthy lymphocytes. So that's very, very important for that immune response to be normal, is to have efficient vitamin D to make those cells. So the dosage is really going to depend on what your vitamin D status is. I know some people are going to know that, some people aren't. But if you know you're low, if you're in the 20s or in the teens, then you're probably going to be more that 8,000 to 10,000 international units a day. At least 5,000 international units is what you're going to want to take in that case. If you're already in the 40s, 50s, 60s, you probably don't need that much. You're probably only going to go to maybe 4,000, 5,000 units at that point. Just keep in mind that once we get over 100 on your vitamin D status, it can be toxic as well. So it is something to watch out for. Another thing I like to note about vitamin D is that it is a fat-soluble vitamin. It does need fat to absorb. So one thing we use in clinic is we use emulsified vitamin D, which helps the vitamin D absorb, and then it makes it a very easy thing to take, an effective thing to take. Now, if we don't have an emulsified vitamin D, then what you can do is you then want to make sure you're getting a source of fat, some food in there with you're taking the supplementation. All right, let's move into the targeted therapy. So again, I mentioned this a little bit earlier, but whenever we're doing whether we're using a natural product, whether a pharmaceutical product to target a virus, there's some specific parts of the viral infection process that we're going to be targeting. Those three areas are the binding to the host cell, the absorption uncoating, which is really kind of pH dependent, and then the replication process. So the first one we're going to talk about is elderberry. I'm sure a lot of you guys have heard about elderberry. Believe it or not, these berries are actually native to North Florida. I didn't know that until about a couple years ago, but that's pretty cool. So if you'd like to start growing your own elderberries, then go get a plant and go for it. So it's kind of a cool feature we have up here. What's cool about the elderberry is there is a compound in there called caffeic acid, which actually will attach to ACE2 receptors. So basically what that ends up doing is it blocks the docking receptor for that coronavirus. So if you imagine those little receptor sites I was showing you to where the ACE2 receptor is, then those elderberry compounds are basically filling those up. So it's basically blocking entrance for that coronavirus. It also tends to disrupt that envelope membrane. So again, remember that envelope membrane is needed to attach to that binding location as well. So you got basically two different mechanisms in where this where elderberry can help prevent the actual virus from entering the cell, which is where we primarily want to stop the virus. The dosage can be 700 milligrams to 1,000 milligrams a day. There is some question, hey, does this stimulate your immune system too much? Some people may refer to that as a cytokine storm. We're going to go more detail about that, but essentially the cytokine storm is basically your immune system made a mountain out of a molehill, and it overreacted so severely that can actually create damage. It can create bacterial pneumonia. It can create sepsis. So that's an important thing to be thinking about. The research that this kind of theory was based off of was actually not that someone went into a cytokine storm. It was just that there is evidence that elderberry supplementation does raise cytokines, but cytokine raise could be part of a normal, healthy immune response. So just because the body does have regulatory mechanisms, so just because something stimulated a normal cytokine response doesn't mean it's going to stimulate an over cytokine response, if that makes sense. Now, that being said, people with severe asthma, people with autoimmune disease, people who are immune deficient, you may want to be a little bit more careful and, talk with a provider on how you would use elderberry effectively. You may want to start off with a little bit lower dose than what I'm showing here. And there's also things you can do to kind of help your body regulate that overproduction of cytokines too, and we'll be talking about that as well. All right, the next thing we're going to talk about is garlic. The antiviral component in garlic is something called allicin. Allicin actually is formed when raw garlic is crushed and it is exposed to air. So if you go out and you can't find any garlic, you can actually take a clove of garlic, crush it, let it sit out for like 10 minutes or so, and then just eat it on down. I know everyone is probably really excited to go try that. I would rather take the pill, but like I said, it is kind of difficult to find some of these things right now. So if you can't, that is another way to do it. Keep in mind that if you cook it, if you change the pH, so if you're making a salad dressing and you're adding vinegar or something like that, you can destroy that allicin compound. So you really actually have to do it the hard way, raw. There was a human trial that showed reduction of cold incidence with 180 milligrams of allicin. Now, to give you a comparison, that is a very low dose. The garlic we use in clinic has 700 milligrams per capsule. So, we can go much, much higher than that. But even at the lower dose, there was some shown benefit. The antiviral activity of allicin is, again, disruption of that envelope membrane. So like we mentioned before with some of the other compounds, that envelope membrane, when it gets destroyed, really helps inhibit the docking station of the virus and then prevents it from getting into the cell. Monolaurin is the next compound that I really like to use. It is derived from lauric acid, which is part of coconut oil. It's a fatty acid in coconut oil. Its mechanism of action is very similar to what we see with elderberry and the garlic. It dissolves the membrane. We've seen that very effectively. In fact, if you can't find any Clorox wipes, there's actually something out there called monolaurin wipes, and you can actually use that, and that can help destroy these viruses on surfaces as well. It does prevent, there is evidence that it prevents binding to host cells. Some of that's going to be the disruption of the membrane, obviously, like I talked about, but also those proteins, those little buds off the membrane that we showed in that illustration earlier, it seems to affect that as well. Dosage, I didn't put dosage on monolaurin like I did other stuff here. Dosage can be, there's actually, if you look at the reference here, there's a proposed clinical trial from a PhD in the Philippines here for coronavirus, the COVID-19, and he's suggesting around 800 milligrams. Some of the nutrients I use, it means that we'll easily go 3,000, 6,000 milligrams of this sometimes. I usually try to start slow and work up with that. But it can really vary from person to person. Okay, zinc is the next one. And zinc, I think this is where I think this gets kind of exciting. I was kind of blown away by where this could lead us and how we could actually take some of this, some of these mechanisms and apply some treatments. Zinc inhibits 3 major proteins in SARS-CoV-1 replication. So this is not the COVID-19. This is this previous SARS-CoV virus, and it inhibited the replication. Now remember, and we're going to go in more detail here. Remember that replication, though, it happens within the host cell. So zinc needs to be not so much in the body, but it needs to be in the cell, if that makes sense. So if the zinc never gets into the cell, it's not going to inhibit this process. Zinc acetate via lozenges are probably the preferred route to do this. That's also something that's hard to find, but zinc as a whole food zinc is something that we use as well, and is something we can be utilized. 10 to 30 milligrams a day is generally what I recommend. Divide that up into doses. You can go higher. Zinc can also, though, disrupt other mineral balance that possibly could affect the immune system. So I'm not necessarily a big proponent of high dose zinc unless we're really having symptoms, and then we might want to go a little bit more aggressive there. But as like a preventative and taking this ahead of time, then I would go with that more 10 to 30 milligrams in divided doses. All right, chloroquine. I'm sure some of you guys have heard of this, right? It's been all over the news. First, before I even go any further into chloroquine, please know if you Google chloroquine, you may run into fish tank cleaning tablets. Do not take those. They will kill you. That's not the same thing, and that's not how you treat this. That's actually already happened. That's the reason I bring it up. So I just wanted to make sure everyone knew that. Chloroquine is a prescribed medication. Any kind of over-the-counter chloroquine as a fish tank cleaner is not what you want to take at all. It is an anti-malaria drug. It's also used in treating lupus as well. It's also shown some promise so far in treating this COVID-19. So what's cool about chloroquine is we do know the mechanism of the action of the drug. It increases cell pH. So basically what that happens, when we talked about that uncoating process, that part where the cell is starting to get deeper in the cell and take over our machinery, when pH increases, it basically starts weakening the virus's ability to go through that process, okay? So then it inhibits it from taking over host cell machinery. It also is a zinc ionophore, and what that means is that it pushes the zinc from out of the cell into the cell, and that's what allows the zinc to then inhibit that viral replication that we talked about before. So what could be a good strategy here is getting the zinc in, but then having some stuff to push the zinc, get the zinc into the body, then having something to push that zinc into the cell. So since we said, chloroquine is not something that we're going to be able to do over the counter, here's just a little diagram of how this works a little bit more as a visual. Again, the chloroquine increases the pH. It helps weaken how the virus can hit the machinery. And then, of course, the zinc is then forced in, and then we have destruction of the replication process. Okay, so the cool thing is there are some natural zinc ionophores. We do not need, in a hospital setting, yes, that might be the best way to do is I'm not saying this is a replacement for the drug at all, but there are some things that we do have evidence of that do a very similar action within the body. So basically, there's some natural compounds that will push zinc into the cells. So those two compounds are quercetin and EGCG. And we know that when that zinc came in with the SARS-CoV-1, that did also inhibit replication. There was evidence of that. So that's really cool. The EGCG, that is something that we find in green tea. Now, if you say, oh man, I drink green tea all the time, it should be good. It actually takes, you'd have to drink quite a bit of green tea to get a real therapeutic dose there. So I do recommend that through a supplementation to be a little bit more effective, where they have that compound extracted. Quercetin is also something, again, that's pretty readily available most of the time. It's better if you take that with vitamin C. A lot of the products you'll see out there with quercetin will have vitamin C added already, and that is a 400 to 500 milligram dosage per day. Okay, so cytokine storm, we're going to kind of cycle back to that and the inflammatory response in general. A cytokine storm, as you see here, is basically an overproduction of immune cells, okay? So if you get a flu, if you get some sort of infection, what can happen is you can have an overreaction of the immune system. It can start damaging the lungs. It can create this inflammation buildup, so to speak, that can lead to secondary infection. So when you hear like, the flu never kills anybody, it's usually a pneumonia or something like that. That's part of the way this can happen, okay? Sepsis sometimes is another issue this. With these SARS-type viruses, we see a lot of the ARDS, which is that acute respiratory distress syndrome. And that's what seems so deadly in the previous SARS outbreak that we saw. And so when we're trying to prevent this type of thing, what we can do is we can use compounds that inhibit this NF-kappa B pathway, which you see right here, which is one of the classic cytokine signaling pathways. So this is one of the pathways that basically stimulate that cytokine production. So here are some nutrients that we use to reduce NF-kappa B. NAC, that's N-acetylcysteine. That's something that is a precursor to glutathione. So if you're one of my patients and you take that trisomal glutathione, that is it has glutathione and the NAC in it. It's a great product. I like that one a lot. But that is a great inhibitor of that NF-kappa B. Lipoic acid, this is also a very good inhibitor of NF-kappa B. It has a short half-life, so basically it's going to get in your body and get out of your body, okay? So dividing the dosages up throughout the day is going to be important. If you're using alpha lipoic acid, you're going to have to take that higher dose range. If you're taking R lipoic acid, you can go on that lower dose range, just so you have a general idea there. Other things to think about that also have evidence of lowering that NF-kappa B, curcuminoids, that's, think about turmeric, boswellia, we talked about the EGCG, you can see there's a bunch of stuff in there that can do that. So, and the reason I put that in there is frankly, we do have to get kind of creative because of the shortage of some of these things. So from patient to patient, we're kind of trying to use what's available and potentially what works better with individual people. Okay, so that's the primary presentation. Now, obviously, I know you guys probably, I'm sure some of you might have some questions here. So if you have some questions, go ahead and putting those into the chat if you do. If you are just totally lost here and like, well, what do I actually take? Then, feel free to reach out to the office. Everyone who's a patient already, we're doing free consultations, adding to your treatment protocol that you already have if we need to go ahead and make sure we're filling the gaps of what you're taking and what you're not taking to maximize your immune function here. So if you want me to do that, just call the office. We will we'll get that set up till we can kind of complete the recommendations for you. If you are not a patient, or if you know someone who think might benefit from this, then have them call the office. We're doing very reduced consultations. We do over the phone, so you don't have to come to the office, so you can still practice social distancing. We'll do a phone consult. We'll get a brief history. We'll look at the prescription medications, make sure there's not going to be no contraindications there, and then we can make a protocol for everyone. If you're having trouble finding some of this stuff, go to our website. You can see it there, healthytallahassee.com. If you go under Design Clinical Nutrition, we do have several links to several different online dispensaries that have some of these different products. I have been flagging some of my recommendations of different products you think you can use, but obviously we're kind of battling against inventory issues, even with the dispensaries. So go through that look, and again, please, if you have any questions, we're here to help you any way we can. So please let us know how we can help.